The coronavirus pandemic has exposed the divisions in our societies. Time and again, we see that economic background affects the likelihood of one catching COVID-19. People from less wealthy communities are more likely to have jobs that put them in harm's way. Working from home, meanwhile, is mostly the preserve of white-collar employees. Poorer members of society tend to face more risk of exposure, living in tight quarters and finding distance a luxury. Existing health problems also make the coronavirus more dangerous to the poorer parts of society. So what can be done to close the gap? How can we ensure that everyone has the same chance of escaping the virus? Welcome to Deutsche Welle's COVID-19 special. I'm Stephen Beardsley in Berlin. It's good to have you with us. Work, housing, pre-existing health conditions all play a role in our exposure to the coronavirus, as well as our vulnerability to the illness that develops from it. That's what experts say, but it's also the lived experience of many in the pandemic's hardest hit neighborhoods. Take a look.
Hesketh, Benoit and his friend are looking for a grave, the one that belongs to their friend Danny. He may have died of coronavirus. Hesketh doesn't know for certain. But Danny is one of 41 friends that he's lost in the past 6 months. All except one were black.
And it's really making me very worried because, I've got children, I've got friends that have got children, I've got close people to me.
Hesketh is a popular figure in the North London borough of Haringey. The 62-year-old pensioner worked as a lecturer at the nearby university and does volunteer work where he can. For example, at a food charity for those in need. He says he's seen how the Black, Asian, minority ethnic or BAME community has been especially affected by the pandemic.
The BAME community shouldn't be hit disproportionately in terms of numbers. And that's why you're getting the bitterness and the sort of worry.
A report in June by Britain's Department of Health listed reasons for the many deaths among ethnic minorities. As indispensable workers in hospitals, food markets, or as bus or taxi drivers, they're more exposed to the virus. Also, housing conditions are often cramped. Risk factors such as diabetes or being overweight are also more widespread. The chairman of the Council of the British Medical Association is familiar with what Hesketh is experiencing and warns that the deaths will continue with the second wave.
It is a duty of any government in any nation to protect its population, protect those that work. Lack of any action plan, the lack of any implementation of clear recommendations that were made in June is extremely concerning.
Hesketh can't find his friend's grave. Only close family members were allowed to attend his funeral. Hesketh hasn't been able to say goodbye to any of his 41 friends who've died.
Now, that report mentions some of the risk factors facing poorer communities during the pandemic: tighter quarters, pre-existing health conditions, and frontline jobs. Now, let's take a closer look at that last factor, jobs. Here's a breakdown of job categories by the percentage of employees who can work remotely. Now, this is based on a study from the OECD. At the top, business and administration, with a whopping 3/4 of workers able to stay home. Roughly in the middle, teaching professionals. And down at the very bottom, mostly jobs that are considered low-skilled, like sanitation and cleaning. Now, they're a mere 1% of workers able to do it from home. And even that's hard to imagine. And I'm joined now by Ricardo Espinoza. He's a policy analyst at the OECD Center for Skills in Paris. Ricardo, it's good to have you with us. Is it fair to say that the better educated you are, the more likely you are to be off the front lines?
Yeah, absolutely. So what we found that there's a lot of evidence showing that when it comes to telework arrangements, those who possess a higher level of skills, say, for example, those who have a tertiary education degree, are much more likely to be able to telework or work from home. So actually, at the OECD Center for Skills, we're conducting research about these issues. And not only that, we will also try to help countries to overcome these difficulties.
Now, Ricardo, the skills divide between those who can afford to stay home, those who can't, perhaps, there was already a skills divide before the pandemic, wasn't there?
Absolutely. So we've been hearing about, for example, the risk of automation for a long time, right? So people are going to gradually be replaced by machines. Now, the problem is that this pandemic might even accelerate this trend, right? So if you think of companies after this pandemic, they'll try to automate as many jobs as possible in order to protect themselves against crises like this or potential other pandemic in the future. So, and in that context, it is very likely that those jobs who are currently performed by people who possess lower level of skills are likely to be automated first. So in that sense, I think that in the aftermath of this pandemic, low skilled people will probably hurt even much more than those who possess a high level of skills, sort of widening the gap between higher and lower skilled workers.
What is the potential for retraining those who might be replaced by automated workers, as you said?
Yeah, absolutely. So I think this is going to be at the center of the debate in the coming years. So I think we have to distinguish between the long term and the short term. So I think in the short term, there's scope for governments or for companies to implement certain policies, first of all, to retain as many jobs as possible, but also to promote, for example, the diffusion of in managerial practices, to share self-management practices in order to allow workers to work from home. But in the long term, this will not be possible without thinking of a strategy to upskill and reskill the adult population. So that's why strengthening adult learning system in general will be at the center of the debate.
And countries are working on and passing these large recovery bills right now. Have you seen any effort to already begin this conversation, or at least even the funding for some of this retraining, or is it too early?
Yeah, absolutely, because countries are reaching out to the OECD, first of all, to help. I think the first step is to help identify those workers, and I think our research points in that direction. So it's important first to identify who are the workers at high risk, and once we are able to identify, is to target the right incentives, the right measures towards those in need. So yeah, this is actually a trend that we've seen over the past month. So countries are worried about this. Of course, in the very short term, they're looking at retaining as many jobs as possible. But once the pandemic sort of fades away in the next coming month, we'll see countries doing more and more to strengthen their adult education system. And they're really worried about this, and this is something we should do in the coming years.
Can we say that people will always be needed for those frontline jobs, those working with your hands kind of jobs that can't really be automated or teleworked out of?
Yeah, absolutely. So there will be many jobs will not be automated easily, right? So I think there will be a transition, let's say, which can take 10, 15, 20 years, who knows, in which we will need many of this sort of manual work, right? So the question is, what do we do with these people? So I think we have to guarantee that these people are able to return safely to their workplaces, but also we need to be able to, that they are able to move to a situation where they can work remotely. So that's why upskilling and reskilling, acquiring skills to move to different positions, for example, will be the center of the debate. And that's something very important to countries to achieve.
All right, a crisis that's still developing right now, and of course some long-term questions. Ricardo Espinoza with the OECD breaking it down for us. Thank you very much.
Thank you, Stephen.
Right, now it's time for your questions, the part of the show where our science correspondent, Derek Williams, answers the questions you've posted to our YouTube channel. Over to you, Derek.
How long is the incubation period for COVID-19?
One of the reasons this virus turned into such a big problem so quickly was not just that it's pretty contagious. The coronavirus that causes SARS, for example, seems to be just as contagious as SARS-CoV-2, if not even a little more so. But that epidemic petered out, and the pathogen basically disappeared after around 6 months. So why didn't the same happen with this virus? Well, to answer that, we have to look at their respective incubation periods. That's the amount of time that passes between the moment of infection and the time when a patient begins to show symptoms. So, in other words, the moment when you know that person is sick. In both diseases, health authorities say the incubation period is similar, ranging from between 2 and 14 days, with an average of about 5 days. The interesting thing, though, is not the length of the incubation period, but what happens during it. With SARS, patients generally hit their peak infectious period after they had begun to show symptoms. And they didn't really seem to pass the virus along to others during the incubation period, when they were unaware that they were carrying the pathogen. So we were able to contain that virus effectively with isolation and quarantining measures. That's a key difference between it and SARS-CoV-2. With COVID-19, research shows that patients are contagious, or maybe even most contagious, in the last couple of days of their incubation period, so before they begin to show symptoms themselves. And experts say those few critical days are one of the big reasons that we'll be unable to get COVID-19 under control without a vaccine.
Our science correspondent Derek Williams there. And don't forget that you can post your questions to Derek on our YouTube channel. And if you'd like to keep up with the latest developments on the coronavirus, do subscribe to our newsletter. Just log on to dw.com/corona-newsletter. And finally, we end with some good news. Rare pink dolphins are making a comeback in the waters between Hong Kong and Macau after ferry service was suspended due to the pandemic. Scientists say the dolphins' population has fallen by 70 to 80% in the past 15 years in one of the world's most industrialized estuaries. This year, their numbers have bounced back as the pandemic means less disturbance to their habitat. Researchers say numbers are up by a third in the area since March. All right, a rare bit of good news there. Thank you for watching our COVID-19 special. That's it for me and the DW team here. For more content dedicated to the pandemic, do check us out, dw.com/coronavirus. I'm Stephen Beardsley in Berlin. Thanks as always for watching.